Let me ask you something. If a person has no symptom, no pain, no visible swelling, are they healthy? Most people would say yes. But what if that same person has early stage oral cancer or undiagnosed diabetes or tuberculosis that has not started coughing yet? Here is the truth that will change how you see every patient you ever meet. Disease and illness are not the same thing. And in this lecture, I am going to show you why. We are talking about health, disease, and infection, but not the way you learned in high school. The way that actually matters in community dentistry and public health. But first, let me tell you exactly what you are going to learn today. Here is your roadmap. After this video, you will be able to define public health like a public health professional, not just a textbook definition, but two key definitions from Knutson and Winslow. You will explain how the concept of health has changed over time, from no disease to something much bigger. You will describe the epidemiological trait, that's agent, host, and environment. You will differentiate between multifactorial causation and the web of causation. You will explain the iceberg phenomena, and trust me, that one will change how you see patients. And finally, you will discuss the phases of public health evolution. Let's dive in. We start with a question that sounds simple, but it's not. What is public health? Welcome, everyone. I'm Dr. Sikander Memon from the Department of Community and Preventive Dentistry at LUMS. Today, we are talking about three words you think you know: health, disease, and infection. By the end of this hour, you will realize that these words mean something completely different in public health than they do in your clinical rotations. Let's start with the most important question. What is public health? And no, it's not just health for poor people. Two definitions you must memorize. First, Knutson said something beautifully simple. Public health is people's health, not patients in a hospital. People in their homes, their workplaces, their schools. Then, Winslow in 1920 gave us the classic definition: the science and art of preventing disease, prolonging life, and promoting efficiency through organized community effort. Notice three keywords: science, art, and organized community effort. Environmental sanitation, infection control, personal hygiene education, early diagnosis, and preventive services. In dentistry, this means community water fluoridation, one of the greatest public health achievements of the 20th century, and school dental programs. Public, because public health doesn't wait for patients to come to the clinic, it goes to them. Now that we understand public health, let's look at how it evolved over time. Public health has a history, and it matters because every milestone changed how we prevent disease. First came the sanitary revolution, clean water, sewage systems. Before that, cholera and typhoid spread through drinking water. Then came the germ theory. Posture and Koch showed us that invisible organisms cause disease. That led to vaccines and antibiotics. And then we realized something important. Infectious diseases were not the only problem. Heart disease, cancer, diabetes, these need lifestyle changes, not just a vaccine. For dentistry, the big shift was understanding that dental caries is caused by bacteria, especially Streptococcus mutans. That one discovery changed everything about prevention. But here's where it gets really interesting. The very definition of health has changed dramatically over the time. This slide is gold. The concept of health has gone through four phases. Biomedical concept: health equals absence of disease. If you don't have a fever, you are healthy. That came from germ theory. But then we realized that's not enough. ecological concept. Health is a balance between humans and their environment. Psychosocial concept. Social, cultural, and economic factors influence health. A person living in poverty with chronic stress, are they truly healthy even without a disease? Holistic concept. Integration of body, mind, environment, and society. Here is a dental example. Oral cancer. Is it just tobacco? No. It's tobacco plus stress plus poverty plus genetics. That's the holistic view, and that's how we think in public health. Here's the mistake students make. They think holistic means alternative medicine or herbs. No. In public health, holistic means considering all factors: biological, psychosocial, social, environmental, not just the germ. That's very different. Now let's talk about actually causes disease. And I promise you, it's almost never one thing. Here is the old way of thinking. One germ causes one disease. Tuberculosis, Mycobacterium tuberculosis, cholera, Vibrio cholera. But most diseases today, especially chronic diseases, don't work that way. That's why we have multifactorial causation. Multiple risk factors work together to cause disease. Periodontitis, it's not just plaque, it's plaque plus genetics plus smoking plus diabetes. Now, there is a point to natural history. We have the natural history of disease, pre-pathogenesis, means before the disease starts. Pathogenesis means the disease develops, and outcome, recovery, disability, or death. And finally, the web of causation, a complex network of interacting causes. Think of a spider web. Pull one thread and the whole web moves. Oral cancer is not just tobacco. It's tobacco plus betel nut plus HPV plus nutrition, all interconnected. Quick check. Pause the video. Name one disease that has a single cause. Yes, tuberculosis. Yes. Now, name one disease that has multiple causes. Heart disease, diabetes, periodontitis, oral cancer. Exactly. That's multifactorial causation. And this leads us to risk factors and risk groups because not everyone is at the same risk. A risk factor is any attribute that increases your chance of getting a disease. And we split them into two categories. One, modifiable risk factors. You can change them: smoking, diet, hypertension. These are your targets for prevention. Two, non-modifiable risk factors. You cannot change them: age, gender, genetics. Imagine an iceberg. The tip you see above water, that's the small part. The massive chunk underwater, that's what sinks ships. Disease works the same way. The tip of the iceberg is clinical cases, patients with symptoms who come to your clinic. But underwater, invisible, are the subclinical cases, the latent infections, the carriers. People who have the disease but don't know it. Here's why this matters for you as a dentist. When you see one patient with advanced oral cancer, how many people in the community have early undetected lesions? How many have precancerous changes they haven't noticed? The tip is what you see. The iceberg is what you need to find. That's why screening exists. That's why community survey exists. You're looking for the part underwater. Think about this hypertension, the silent killer. Most people with high blood pressure have no symptoms. They are the underwater part of the iceberg. When they finally have a stroke, there's the tip. How do we find the underwater part? Screening, exactly. Now, let's zoom out and look at the big picture, the phases of public health evolution. Public health has gone through distinct phases. First, the sanitary phase, clean water, sewage systems. This phase saved millions from cholera and typhoid. Second, infectious disease control, vaccines, antibiotics, understanding germ theory. Third, lifestyle and chronic disease phase, addressing smoking, diet, physical activity. Because heart disease and diabetes became the big killers. And now, universal health coverage, ensuring that every person, regardless of income or location, has access to essential health services. For dentistry, that means universal oral health coverage, a future where no one has to choose between food and a tooth extraction. And that brings us to the Millennium Development Goals, the world's first serious attempts to measure public health progress. Between 2000 and 2015, the world worked on the Millennium Development Goals, eight goals to reduce poverty and improve health. Key ones for us: reduce child mortality, improve maternal health, combat infectious diseases like HIV, malaria, and tuberculosis. What is the dental link? Malnutrition. A malnourished child has higher risk of dental caries, cavities, and enamel hypoplasia, which is defective enamel development. So, when we work on poverty and nutrition, we are also working on oral health. Public health is connected. After the MDGs came health for all in the 21st century. Let's look at that. The MDGs ended in 2015. Then came the Sustainable Development Goals, SDGs, with a broader vision, health for all. Key focus areas include reducing childhood stunting, that's chronic malnutrition, reducing maternal mortality, increasing life expectancy, providing safe water and sanitation, and strengthening national health policies. For dentistry, the goal is universal oral health coverage, meaning every person, regardless of where they live or how much money they have, should have access to basic oral health services. That's not charity, that's public health. That's what we are working toward. Before we wrap up, let me give you a quick reality check. Quick check. Number one, a person without symptoms is always healthy. False. Iceberg phenomena. They could have undiagnosed hypertension or early oral cancer. Number two, most chronic diseases have a single cause. False. Multifactorial causation, multiple risk factors interact. Number three, public health only focuses on treatment. False. Public health is about prevention, organized community effort, and symptoms, not just treating one patient at a time. How many did you get it right? If you got all three, you are thinking like a public health professional. Now, let me summarize everything you need to remember. Here's what I want you to remember. 1. Public health is organized community effort to prevent disease and prolong life, not just treating sick people. 2. The concept of health has evolved from biomedical to holistic. We now consider body, mind, environment, and society. 3. Most diseases are not caused by one thing. It's multifactorial causation and a web of causation. 5. Use the risk approach. Target high risk groups, not everyone equally. And 6. Our ultimate goal is universal oral health coverage. Access for all. Now, your turn.